I am Dr. Kiran Kumar K, consultant psychiatrist and director of the Nirvana Center at Marathahalli, Bangalore. Stress in times of COVID. Probably it's a pertinent question from the past few months. Whenever we are exposed to something unknown, something challenging, we perceive a normal amount of stress and anxiety, which is definitely normal. But COVID-19 as a pandemic has not only brought about stress of infection, stress of unknown, it has also brought in a paradigm change in the way we think, in the way we act, in the way we behave. Why is that? Be it work from home, be it lockdown, be it social isolation, be it physical distancing, be it digital learning from children, be it the whole family sitting in the house for months together, domestic violence, increased use of substances, obesity, lack of exercise, they have all thrown up challenges which we commonly term as stress. Please note, stress is a cascade of chemical changes that occurs in the brain which leads to a lot of physiological changes and behavioral changes. Stress can have devastating effects, particularly if it becomes chronic. It is an harbinger for various psychiatric disorders, also medical disorders, be it diabetes, be it hypertension, be it cardiovascular diseases or stroke in the future. How do we manage stress? Yes, we all know COVID is a temporary situation. It is definitely going to improve. But yes, we need to see how we can learn some adaptive coping ways to understand and wiggle out of the stressful reaction or stressful stage. So how do we go about with it? We know that it is a temporary reaction, it is a temporary change and it is going to end. Various people have had various emotional reaction to stress and it has been going on since February to March of 2020. People are in different phases of emotional reaction, be it denial, be it anger, be it bargaining, be it stuck in depression, or some of us have accepted and have gone ahead. So how do we accept and how do we move ahead? We rather need to work on changing what is feasible, what is possible, rather than changing what is not feasible. What does that mean? The way we work, the time duration, our screen time, intake of substances like alcohol or nicotine, spending quality time with family and friends, regular exercise are all things that is in our hand and we can do it. Yes, we need to be aware, we need to be informed about the pandemic, but excessive information, the so-called infodemic, watching news channels 24/7 is a big no. Always get information from authentic sources, be it from Government of India website, be it from doctors, be it from experts, but never from the WhatsApp University or Dr. Google that most of us do. Most of my patients ask me, what should we learn to get out of this stress? I tell them that answer is, we need to learn. What is that learn? L for laugh. Humor is a wonderful way of de-stressing. E for exercise, regular exercise is very, very important. A for attitude, having a positive attitude is very, very important. R for rest, adequate rest is very, very important. So also adequate relaxation. And N for nutrition, having good nutrition is at most important. So what is that you need to do to get out of stress? It is learn, L-E-A-R-N. So that's the way we get out of the stress. Hopefully, we need to understand that we are going to end this pandemic very shortly, and at the end of the pandemic, all of us should have beaten the stress and come out with something new that we have learned in this stressful state. Thank you very much.